Good afternoon, everyone. We are 1 minute out. Good afternoon, everyone. I'm Nirav Shah from the Maine CDC. Pleased to be able to join you today to provide you all an update on where we are with respect to COVID-19 for today, Wednesday, June 23rd, 2021. And I begin this afternoon's update on another sad note. Maine CDC is reporting 2 additional COVID-related deaths today. One was a resident of Penobscot County, the other a resident of Piscataquis County. One was a woman, the other was a man. One was in their 60s, and the other was in their 80s. These 2 deaths bring the total number of deaths in Maine associated with COVID-19 to now 856. I'd like to take a moment to offer our deepest condolences to the friends, family members, and communities of these 2 individuals, as well as all 856 who have died. Overall, across the state, we have registered 68,877 cases of COVID-19, representing an increase of 13 cases since yesterday. Cumulatively, we've had 2,066 people hospitalized. And right now in the state, 32 people are in the hospital with COVID. 16 of them are in the critical care unit, and 5 of them are on a ventilator. In terms of our overall testing metrics, our PCR positivity rate now stands at 0.9%, and our PCR testing volume is at 197 PCR tests per every 100,000 people. What I'd like to take a minute today to do is to talk a little bit about vaccines and the importance of vaccines, particularly in light of things like new variants that we've seen on the horizon. Let's start with the numbers, first of all. As of this morning, 60% of the entire population of the state of Maine is fully vaccinated. From 0 to 100 plus, for the entire state of Maine, 60% of the state is now fully vaccinated. If you zoom in on just those who are 18 and over, 70% of the state is fully vaccinated. And if you zoom in even tighter on those who are 65 and older, those who are elderly, just a shade under 90% of the state is now fully vaccinated. Those are great numbers, and those numbers put us in a strong position to withstand the remainder of the pandemic as it stands right now, as well as to be prepared for a potential uptick in cases should that occur at any point in the summer or the fall. It also puts us in good position to contend with the emergence of more contagious strains of COVID-19, such as the Delta variant, which I'll talk about in a moment. But in terms of vaccinations, we're doing well, but we've got more to do. One of the ways that we are trying to encourage vaccinations is via the sweepstakes. Over 226,000 people have registered to take part in the sweepstakes. And since we announced it last Wednesday, almost exactly a week ago, 8,713 people have been vaccinated. If you've been waiting on the sidelines to get your shot, now is the time. Not only will you have protection against COVID, as well as the new variants, which I'll talk about in a minute, you will also have a chance to be registered for a drawing of up to $900,000+. So what I would recommend for folks who have been not sure whether they want to go ahead and get vaccinated, my message for you is now is the time. Now is the time not to be waiting on the sidelines, but rather to get into the game. I urge you to get vaccinated and then register for the sweepstakes. You could win. And of course, we all win because every single person who gets vaccinated now cuts off a potential chain of transmission later. The best way to register is, first of all, to go get vaccinated. And then the second of all, or the best way to find where to go register is to just go to your favorite search engine and type in Maine COVID sweepstakes registration. That'll take you to a page where you can register either for yourself if you're an adult, or register on behalf of someone 12 and over if you're their parent or guardian. The registration will be open until midnight on June 30th. And thereafter, there will be a drawing for the single winner for the prize. And that prize will represent the total number of people who have gotten at least one shot of COVID-19 vaccine since the beginning of the COVID vaccine era, since December 15th. So even if you got vaccinated back in January, February, or March, you can still register. But if you're on the fence about whether to go get vaccinated, hopefully the enticements, both of the wealth of the health benefits of the vaccine, plus the potential wealth benefits if you win the sweepstakes, will be what tips you over the edge. It's really important to get vaccinated now, especially as we are seeing new variants on the horizon, particularly the Delta variant you've likely already heard about. Here in Maine, we have detected 4 cases of the Delta variant, and there are almost certainly more cases out there. This variant raises concerns. It's more contagious, it's probably more likely to land you in the hospital, and could potentially even be more deadly. Now, the good news is that the vaccines that we have are effective against the new Delta variant, as well as variants that have been described to date. But the Delta variant threatens to undermine the progress that we as a country and we as a state have made against COVID. Getting vaccinated is the best way to protect us all from variants like this. Not being vaccinated leaves you, your family, and your community at greater risk. In a sense, the Delta variant is really the first post-vaccine variant. Now, to be sure, there are pockets of the country, pockets of the state that are protected against it, despite its greater transmissibility, despite its greater hospitalization rate, and despite its greater likelihood of causing death. For folks who are already vaccinated, the pandemic's newest chapter posed by the Delta variant is really something of an epilogue, since for folks who are vaccinated, the main story has pretty much already been written. But for those who remain unvaccinated, by choice or by chance, the Delta variant is sadly the latest in an ongoing thing that could potentially undermine our overall progress against COVID and pose new risks. To date, the Delta variant is the most concerning variant that has been described, and one that again threatens to undermine the work that we've done collectively over the past 15 or 16 months. I strongly recommend, more so than ever, that again, if you have been waiting on the sidelines, determining whether now is the time to get vaccinated, in light of the emergence of this variant, one that is already spreading in other places in the United States, one that, according to Dr. Fauci, accounts for 20% of new cases in the United States and an even greater percentage of new cases in the UK, it's only a matter of time before it takes greater hold here in Maine and causes an increasing number of cases among those who are not vaccinated. So again, if you have been waiting to see whether or when to get vaccinated, now is the best time to do so. So with that, I'm going to turn it over to our colleagues in the media. The first question today goes to Chris Costa.
Hi, Dr. Shah. Thanks for taking our questions today. I'll keep along the Delta variant theme, if you don't mind. I know that in the past, when we had talked about lifting travel restrictions, the quarantine and testing requirements from people traveling into Maine, you had said previously, if we notice some type of concerning trend, we might reinstate some of those different tactics. Is there any plan right now by the Maine CDC or DHHS or is there even a discussion to start reinstating any of those things given the emergence and spread of the Delta variant?
There has been talk about it. Of course, we review all of our data, not just in Maine, but nationwide on a frequent basis. And so when we review those data, Chris, we're on the lookout for particular hotspots where we see that the variant is emerging with great force and ferocity. And as we think about things like travel restriction, how that might inform that policy. You know, what we've seen of the Delta variant is that there is not a particular or focal hotspot where a travel restriction would make sense. It's everywhere around us, including in Maine. And that is yet another reason why a travel restriction isn't something that's in the cards right now. That is to say, the threat posed by the Delta variant is not one from outsiders coming to Maine and bringing the variant with them. The threat of the Delta variant is here already. It is a threat that is posed by the fact that the variant is already existing in Maine, it's already circulating, and if folks aren't vaccinated, it will have that much more of a chance to get a foothold.
Understood. So then I guess I'll just move on to my second question then. And I wanted to just double check there was a number you had mentioned regarding the sweepstakes and the number of people who had been vaccinated since the sweepstakes was announced. I think you had mentioned a number of, is it 8,713? Is that just for new first doses?
Yes, that is correct, Chris. That is new first doses of 12 and over. Well, that's all who can be vaccinated, but you're correct.
Okay, and I just wanted to kind of get your interpretation of that as far as the number of people vaccinated since the announcement. What do you make of that number?
Yeah, I'm encouraged by it. I mean, for them, for those 8,713 people, not only are they protected against against the virus and the variants, but they now have a shot at entering the sweepstakes and being eligible for $900,000 or so. That amount will be determined on July 4th. You know, we're at the stage, Chris, where it's not so much about the number of people we vaccinate every day, although that matters, but it's less about the number and more about who are those folks. And if these are folks who, again, may have previously been uncertain or unsure about whether they wanted to get vaccinated, but are now coming forward and saying, you know what, I'll do that. COVID is concerning to me and I've got a shot at winning some cash, then I think that's a great thing. That's what matters right now. And we've got, of course, another week to go before the registration for the sweepstakes closes. We're hoping that we can get even more folks in the door in the next 7 days. Now, you can still get vaccinated even after June 30th, don't get me wrong, but the sweepstakes registration is what ends on June 30th at midnight.
Okay, thank you, Dr. Shah.
Thanks, Chris. Let me turn it over to Emily at the Sun Journal next.
Hi, good afternoon, Dr. Shah. I have a couple of questions, and the first thing I want to ask about, I actually want to go back to the beginning of the pandemic. I had spoken to a number of doctors and nurses from the Lewiston area about a week ago, and some of them said that they worked in the emergency department, and they were seeing a large influx of patients with flu-like symptoms in December 2019 through January, February, March, and that they were testing negative for the flu. And I'm wondering if it's possible that we had COVID here in Maine before we had any readily available tests that confirmed it, because that was their theory. But you know, of course, there's no way to prove that in retrospect. But I'm wondering what your opinion on that is.
So, Emily, in the recent 2 weeks or so, there have been some new data that have come out looking at when COVID may have first emerged or found its way to the United States. We've classically assumed that it was a person in Seattle, which was the first case, but almost certainly COVID existed in the United States before that. Now, how much before that is the question. Here in Maine, our first confirmed case was on March 13th. but is it possible that COVID existed here in Maine between December and March? Almost certainly the case. But whether a particular patient at the end of December or early January who was in an emergency department would have had COVID as opposed to the flu, as you noted, it's very difficult to determine that right now. Point of care flu tests are good, but they're not 100%. There are also a number of other viruses and bacteria that can cause very similar types of illnesses from an emergency room perspective. It could be RSV, it could be other bacterial causes in addition to COVID. Make no mistake, it's likely the case that as in every other state, there were cases of COVID around before the first case was officially diagnosed. But how much further that goes back, was it to December? Was it even before December? That's the open question. I've spoken or had the privilege of being on calls with folks who have discussed these data, and going back and figuring these things out now. It's certainly an interesting exercise, but having a degree of finality around it, that's what's challenging.
Okay, thank you. And my next question is, the CDC did come out earlier this week with vaccination rates for healthcare workers in Maine. And I noticed that Central Maine Medical Center and St. Mary's Regional Medical Center, both in Lewiston, were the lowest, had the least amount of healthcare workers vaccinated. And I'm wondering, we've talked a lot about Androscoggin County. What your take of that is that reflection of something going on locally, or what are your thoughts?
Yep, St. Mary's in particular drew my eye as well, Emily. I can't speculate as to the reasons. I've spoken with my team to try to get a better sense of what is driving the variations across the state of Maine, and what the higher vaccination healthcare facilities are doing that we can learn from, what types of tactics and carrots they're using that we could potentially learn from and replicate. And then at the same time, what the lower performing hospitals may not be doing that we could help with. But as you noted, particularly St. Mary's, but CMMC as well, did catch my eye. Time will tell what the exact reasons for those numbers are, but make no mistake, number one, they are concerning. And two, the question is the extent to which they are reflections of case rates in Androscoggin County, or whether they may even play a role in those cases. Those are the epidemiological questions that we're starting to look at now that we've got these data in hand. The bottom line here is clear though. Healthcare workers should have the COVID vaccine on board, particularly as we think about the number of people who have been affected and needed to be in the hospital. If you're a healthcare worker, I think if you haven't been vaccinated already, now, again, there's no better time to get vaccinated to protect yourself from potential exposure, as well as to protect your patients.
Thank you, Dr. Shah.
Thanks, Emily. Let me go to Mel Meyer next.
Hi, Dr. Shah. My question is about the testing volume. Are you factoring that in, and how that might be impacting new infection rates since the numbers are so low at this time?
Yeah, Mel, that's a good question. We've looked at that because testing volume has gone down, not just in Maine, nationally. The number of folks who are getting tested has come down, and that makes sense. If you are fully vaccinated, unless you have really consistent symptoms that are really consistent with COVID, there's not a reason to get tested asymptomatically, for example, to take part in surveillance testing. And so it's not unexpected that testing volumes would go down. Now, what does that mean, as your question notes, Mal, for what we call case finding? How good do we feel about the numbers that we've got every day, given that not everyone is being tested in a way that they were 4 months ago? One of the things that we do, Mal, or that our team does, is adjust the testing volumes for those who are unvaccinated. Here's what I mean. If you assume for a moment that the only people who are getting vaccinated who should be if you assume for a moment that the only folks who are getting tested, who should be getting tested, are unvaccinated people. As I mentioned a moment ago, here in Maine, about 60% of our population has been fully vaccinated, leaving about 40% of our population who might need to partake in testing because they're unvaccinated. If you adjust the testing volume to just zero in on the unvaccinated folks, you see that our testing volume has not fallen as precipitously as you might think on first glance. And that's because, again, we're zeroing in on those who are unvaccinated. That's kind of the way that I think about it in my head and how we model it out. When you make that adjustment to really think about it as a matter of unvaccinated folks, you see that our testing volumes are still in a good ballpark to allow us to have confidence in the fact that the cases we're seeing are a good representation of the cases that are out there.
Gotcha. Okay. And then my second question is about the vaccine sweepstakes. When other states were announcing their vaccine sweepstakes, it was, when the vaccine drop off, I guess, if you want to call it that, started to happen, they saw a good bit of a bump. Are you looking deeper at the breakdown of when people are saying that they're getting vaccinated and when they're registering? Because you have to provide that kind of stuff when you're signing up. So are you looking at that? And how are you going to overall measure the success of the sweepstakes?
Yep. We absolutely are looking at that now. And, there are different ways to think about the impact of a sweepstakes. One would be just, did it cause an uptick in the rate of vaccinations overall? We'll see at the end of the sweepstakes where we landed on that. But the other, Mal, is, did it prompt folks who were on the sidelines to get in the game and get vaccinated? Maybe the numbers there, net are not as high, but if what we are capturing are folks who are on the margin, on the knife's edge, and this is what tilted them in that favor, then that's a win for sure. Again, I don't know what fraction of those 8,700 people in the past week were not going to get vaccinated, but for the sweepstakes. We'll have to do deeper surveys and focus groups to get a better sense of that. But that's really the question in my mind. Even if it doesn't cause an uptick in vaccination rates as a state, if it prompts folks who are saying, I'm not sure if this is for me or not, to come in and go in and get vaccinated, that's a win. I will note that the individual who was the second winner of the lottery that was being done in the state of Ohio, when he was interviewed, I was compelled by the fact that when he was interviewed, he said straight up, I wasn't really going to get the vaccine, but then I heard about this chance to win money, and that's when I signed up to go ahead and get vaccinated. Let's see if that unfolds here in Maine, but I think that's the ethos that we're looking at.
And sorry, one last question for you. Since the beginning of the vaccine rollout, one of your focus has really been on not wasting any doses. Now, knowing that there are fewer people seeking out the vaccines to get vaccinated, and that these people might be scattered all across the state whenever they are wanting to come and get vaccinated, that could be at any point in the future. How do you kind of factor all of those things in to see how much should still be ordered, and how do you distribute that so that way they are available once people are ready?
Yep, great question, Mal, as well. The round about May 18th, if memory serves, May 15th or May 18th, the US CDC and the federal government changed their thinking with respect to wasted doses or unused doses. At that time, the supply of vaccine overall had grown to be quite significant in the US, and demand for vaccine was starting to drop off, meaning that if you opened up a vial for 2 people, you ran the risk of having 2 or 3 unused doses. The US CDC and the federal government okayed that scenario. That is to say, focusing on getting every single person who wants to get vaccinated at the time they show up, even if it entails that 1 or 2 doses in a vial, maybe even more, might go unused. Here in Maine, we changed our policy accordingly. That policy is on our website. And what we urge providers to do is to make every possible effort to use up all the doses in a vial, because the vaccine is still precious. And certainly in other parts of the world that don't have the privilege that we do here in Maine and in the US, the vaccine is even a higher value commodity. So we ask providers to make every available effort to use every dose within the vial. But if they can't, to focus on the patient who's in front of them. Because the vaccine supply has grown so much in the state, we haven't faced supply shortages, but Mal, we still do what you mentioned, which is we are still moving doses around. We still don't want doses to go to waste. So if a particular provider calls us and says, we have 100 doses that are expiring in 2 weeks, we'll grab those and move them to somewhere that can use them immediately to even further minimize what goes to waste. We haven't stopped doing that, and I don't foresee us stopping.
Thank you.
Yep. Over to Allison Ross next.
Hi, Dr. Shah. Thanks so much for taking my question. So just one question today. When you're talking about this new Delta variant, you're saying it could be more contagious and potentially more deadly. So is that also true for the younger populations, maybe the teens and also people in their 20s? Is it also potentially more deadly for them as well?
Thanks, Allison. Let me start. I'm going to break your question into two components: contagiousness and then risk of serious illness. On the contagiousness front, the data from particularly the UK, which has been well analyzed, but also the data from India, have shown that the Delta variant is definitely more contagious, and younger folks, both teenagers and adolescents, as well as folks in their 20s and in their 30s, actually across the spectrum, the Delta variant is more contagious. Now, in terms of the rate at which it causes more severe illness, particularly in younger folks, the data that we have right now suggests that it does increase the likelihood of somebody landing in the hospital if they're younger, 12 to 18 or 18 to 30. The data on deaths are still being analyzed. And so based on the early read of the data from a group in Scotland, it appears that the Delta variant is more deadly, but there needs to be more analysis before that conclusion is more broadly accepted scientifically. It appears that way right now as to deaths, seems more strong for hospitalizations, and most definitely the case for contagiousness.
Thanks.
Thanks, Allison. Over to Kevin Miller next.
Great, thanks, Dr. Shah. So, obviously, Maine continues to have one of the highest vaccination rates in the country, which is great. But as you noted, the pace has slowed down. And as the sweepstakes, you said about 8,000 cases. It seems like we're in a week's time, we're doing less shots in a week than we were seeing in a day during the height of the vaccinations in March and April. And so I guess my question is kind of what's next for the vaccination campaign? Where do we head now, once we get past the sweepstakes?
Yeah, that's very much been on our minds, Kevin. What's next, post July 4th is to really zero in on who hasn't been vaccinated. You're right. I'm so proud of where we stand in the league tables relative to other states in our vaccination effort. But folks probably know by now, and the governor noted last week, we're a pretty hard driving bunch, and so doing well isn't good enough. We want to do even better than that. So our plan is to take a deeper dive into understanding who specifically hasn't been vaccinated in Maine after the June 30th. And we're going to ask a couple of questions, and we're going to get at it through different ways: surveys, perhaps focus groups, things of that nature. But in general terms, Kevin, here are the questions we're going to ask. Who hasn't been vaccinated? Where do they live? Why haven't they been vaccinated? What message might compel them to become vaccinated? What messenger would be best suited to deliver that message? And then finally, in what setting would they wish to be vaccinated? That, I think, informs or will give us better, more than just the broad contours, but specifics around this remaining group of folks who haven't been vaccinated. Why haven't they been vaccinated? What's holding them back? For some, it may just be that they don't think the risk of COVID outweighs the risk of the vaccine. We can talk about that with them. We can talk about, for example, the Delta variant, which gives me concern as we think about unvaccinated portions of the state. For others, Kevin, it may just be there's not a place to get vaccinated anywhere near them. That's a sign. That's something that we can work on. For others, it may be that they can't get time off of work, so on and so forth. You see where I'm going with this, but that's going to essentially be the next phase of our vaccination effort, trying to get a much better sense in specific terms, not general terms, about the reasons why folks have not yet been vaccinated.
Do you have, do you have a sense at this point as to, what those pockets are? I mean, we're obviously seeing geographic disparities, but those have been, throughout this vaccination campaign. But do you have a sense? Is it mostly that younger population? Is it the rural population? What's your theory at this point?
Yep. At this point, Kevin, certainly what you noted. There's no question that there is a we've got more work to do in our outreach efforts to younger rural populations, younger rural men in particular. But I don't want to stop the analysis there. Even within one of the things I've asked the team to zero in on is even sometimes when you look at these maps, you can glide over the fact that even in a highly vaccinated zip code, there are pockets of folks who are unvaccinated. Perhaps again, because their employment situation means that it's tough for them to get vaccinated at a time that works for them, so things of that nature. So one way we go about this is by looking at the map. But I don't want to stop with the maps, because that can, again, glide over these pockets that may be small but significant and not appear on a map. And I have a sense, Kevin, or I'm interested in an additional hypothesis, which is that social determinants of health are a barrier just as much as in rural counties it may be ideological. In other places it may be social determinants. Again, getting time off of work, having transportation, making hours for vaccination sites work for them. So time will tell. It's going to be an empirical question as much as it is anything else.
Great. Then one quick follow-up. Oh, go ahead. I'm sorry.
Oh no, I'll say, Kevin, when folks talk about following the data, often they mean the biological and epidemiological data. This will be an instance where we'll be following the survey and the qualitative data as well.
Okay, great. And then just last real quick, are you still seeing a lot of interest from doctors' offices and that are interested in getting vaccines and doing their own individual clinics?
Yes, we are. In fact, just yesterday, I got a note from the senior leadership at one of the large hospital systems here in Central Maine that they're going to be moving more toward primary care in office vaccine settings. So we're starting to see that interest and that transition happen gradually across the state. One of the things that we've been doing there, Kevin, in the spirit of your question, is diving deep. Again, we've already seen interest from many practices, but not all practices. So I've asked our immunization team to zero in on parts of the state where we know there's a lot of doctors' offices, but those offices haven't taken us up yet to start ordering vaccine. What are the barriers that they face? We've learned a lot from having those conversations. Some practices want smaller delivery sizes. They may not need 100 per week. Not a problem. We can break them up and get them 20 doses a week. So we're having those really detailed conversations. My goal right now for the next phase of vaccination, if I had to summarize it, it's going to be typified by removing barriers. Removing barriers from people who want to get vaccinated, for doctors' offices that want to order vaccine, so on and so forth.
Great. Thank you, Dr. Shah.
Yep, thanks, Kevin. Over to Amy Brown next.
Thanks, Dr. Shah. First, I have a question from a listener who writes, quote, when the Maine CDC reports the numbers for new COVID infections, hospitalizations, and deaths, why does it not simultaneously disclose how many of each involved unvaccinated people? They say, I suspect this would be nearly 100%, and wouldn't that be another excellent incentive for people to get vaccinated, end quote.
Well, we do for hospitalizations, as you know, Amy, we report those about once a week. And what we've seen since we've collected those data is that about 80 to 85% of folks who are in the hospital being treated for COVID-19, 80 to 85% of them are not fully vaccinated. To me, that number is staggering. To think that something as simple and safe and no cost as a COVID shot could reduce your risk of landing in the hospital so dramatically, that to me in and of itself speaks volumes. As to the other elements of it, the bottom line answer is that we may not know. We get reports of laboratory results of COVID. We could delay reporting those so that we can figure out whether whether they were vaccinated or not. But that introduces a delay in the process, not something I want to do. I don't think, for transparency reasons, I don't want to delay that.
Do you have a sense, though, overall, what percentage of the positive tests that are coming back, since there's so few of them now on a daily basis, are for people who are not fully vaccinated?
We really focus on hospitalizations because that's where the data are a lot more attainable and where they really have clinical implications. So we really focus, as does the US CDC, on hospitalizations and vaccination rates there.
Great. And you've mentioned in recent weeks that a larger percentage of the hospitalizations had been among younger people. Is that still the case? Can you give kind of an update on, if you have it, the percentage of among the 32 people who are hospitalized over the last couple of days would be under, say, 50?
Yeah, I can get those breakdowns for you, but in general, you're right. The overall trend in hospitalization since March February has been that those who are being hospitalized in Maine for COVID treatment are younger, they're sicker, and they often stay in the hospital for a longer period of time. That really hasn't changed in recent weeks.
Okay. And finally, is there any news regarding Pfizer's application for full approval? Do you know how long those kinds of things usually take?
It really depends on what type of data was in their initial submission. The US FDA would have more up-to-date info than I would there.
Okay, great. Thank you.
Yep. Let me go to Brian Sullivan next. Brian? All right, we'll come back to Brian. Jessica, over to you.
Thank you, Dr. Shah. First up, I know the Maine CDC or DHHS used to put out numbers every week with how many vaccines the state was ordering. And I was wondering if you could provide an updated number specifically on how many Pfizer vaccines the state has really received over the past month.
Over the past month, I don't know that we've put in any orders for Pfizer over the past month. I can check. I don't believe that we have. If we have, the order size would be quite small. We've been largely relying on the vaccine that's in the state and moving doses around across the state rather than using or ordering new doses when we have vaccine in the state. I can check to see, but I don't recall that we've put in any orders for Pfizer in the past 30 days.
So if the state hasn't put any orders, is there still some coming in from other states or?
Yeah, we move doses around, not just, so we can receive doses not just from Operation Warp Speed and McKesson, but from other states, from the VA system, from other providers here in Maine that may have their own independent supply of Pfizer pharmacies, for example. So if they don't need those doses or they're expiring, rather than shipping them in from a warehouse from Memphis or wherever the Pfizer warehouse is, we use the ones that are already in the state from other providers.
And do you have numbers at all for how many doses that is, or how many doses have come in from other states?
Of Pfizer in the last 30 days, I don't have that number, but I can check. I don't recall that we've imported any Pfizer from another state in the last 30 days, but again, I can check. But I think we've largely relied upon the stocks of Pfizer that were already in the state. Pfizer doesn't face the same expiration challenges as, for example, J&J does, probably because of a function of how cold it's maintained. It can stay in an ultra cold environment for several weeks and months.
All right, thanks. And then switching gears, Emily brought up earlier the issue of nursing home staff and hospital vaccination rates. And I was wondering if there were any ongoing conversations at the Maine CDC about potentially making the COVID-19 vaccine mandatory for health workers.
certainly we discuss any and all policy any and all policy ideas that are out there. We certainly discuss. So no question about that. I think where we are right now is, a couple of things. The first is the facilities are able on their own to mandate the vaccine, as one very, very prominent healthcare facility in Houston has done, for example. The question for us is, given where we are in the pandemic, what's the best strategy? Is the best strategy to continue relying upon the facilities to work with their employees to do what's best for their patients? Because in some facilities that has yielded vaccination rates of over 90%, I believe in the case of Millinocket Regional Hospital. In others, it's been lower. So what accounts for those differences? I think before we jump to something like a mandate, I want to know what's driving these differences in the first instance. Of course, we've talked about some of these other policy options. There are some impediments that have been noted, or at least concerns that have been articulated, one of which Amy Brown referenced this as the full approval of the vaccine, whether that may alter the calculus. So the discussions are underway. I don't think any final decision has been made. Where I am at right now is to work with facilities to help them work with their staff to make sure they're fully vaccinated. Generally speaking, I'd rather start with the carrot rather than the stick.
All right, thank you.
Let me go back to Brian.
Can you hear me now?
Yep, sure can, Brian.
You think I'd have this figured out by now? My apologies. I wonder if you could look down the road a bit, and I've asked you about boosters in the past and just the latest on what you're hearing about the need for them. And as you get into flu season, could a flu shot and a COVID-19 booster ever be a 2-for-1 that somebody gets at the same time?
Yep. Okay. So let's start with the former question, Brian, about where we are with boosters. Let me say this at the outset. We, the state of Maine CDC, and then state health departments across the country, we're planning for the possibility of boosters. I want to be really careful. That does not mean that boosters are going to be needed. Not at all. That decision has not been made. I am not the one to make that decision, and I don't know when that decision will be made, but it'll be made at the federal level. But I am not going to wait around, until whenever in the late summer and early fall for folks to say, oh, there's going to be boosters, and then have us to be scrambling to get a system in place. So our team, even though they've been working nonstop, we're starting the process of thinking about and planning for boosters. That doesn't mean they're coming. I just don't want to be caught on the short end if they do come. I'd rather plan and not have boosters than not plan and then have them sprung upon us. So that's the point that I really want to make first and foremost. Secondly, in terms of what the latest is, I had a chance to speak yesterday or be part of a call with one of the senior folks at the US CDC to talk about all manners of COVID. This was obviously a topic that came up. There's actually an advisory committee to the US CDC that's meeting today, tomorrow, and Thursday. One of the items on their agenda is to review some of the latest data. I think advisory committees like that work with the CDC and the FDA will be providing input. And ultimately, I think it'll be a decision for those federal agencies, but I don't know when that decision is going to come. And then in terms more generally, Brian, of where we go with vaccination, I mentioned with Kevin Miller, we're kind of regrouping and trying to think about barriers that we can remove.
Okay. And then I just have a couple of broadcast related questions. I wonder how the drawing will be handled for the person who wins the sweepstakes. Are we going to be able to watch that live like it's the Megabucks or something like that? And also after next Wednesday, when the state of emergency ends, are we still going to see your smiling face each Wednesday at 2:00?
Brian, you took my clothes away from me. Oh man.
I apologize.
Right.
Well, let's don't forget I asked that. And what about the?
Yeah,
the
I'm just gonna disregard that piece. But as to the former, the mechanics of the drawing, it's probably going to be a little less telegenic or photogenic than you and your colleagues may have hoped for. There will not be a giant machine with swirling ping pong balls. I tried, it wasn't in the cards, but it's going to be done electronically. There will be a random number generator process. It'll be done under pretty tight security to make it, obvious for all the obvious reasons. We're working on but the actual notification of the winner, for example, that will be done again privately. We have to verify after the person has been selected whether they in fact meet all the criteria that we've set forth in the rules and regulations. And then after all of those hurdles have been overcome, then we'll talk about making that person more available, probably sometime on the afternoon or the evening of the 4th on that Sunday.
Thank you.
Yep. Let me go to Charlie next.
Yeah, hey, Dr. Shah, thanks. My first question you may have answered in the past, so apologies if it's redundant, but you mentioned before, it may have been after Amy Brown's question, that the younger, sicker, longer stays of people in the hospital. Do you think any of that is related to the higher prevalence of the different variants in the state?
Oh, okay, got it, Charlie. Yes, but I can't quantify that. So the Delta variant is definitely more prevalent, has been detected, but has not achieved the prevalence that it has seen in other parts of the globe or other parts of the country. That 20% figure that Dr. Fauci mentioned yesterday. Overall, as a state, the variant that we have detected the most of is the Alpha variant, what used to be called the 117 variant. And that's really the one that we've seen the most of. The Alpha variant is associated with higher hospitalization rates overall. But to your question, Charlie, can I draw a straight line between the variants and increasing hospitalization rates? I can draw probably a curved line, but not a straight line. That is to say, in general, the circulation of variants, which we have detected in Maine, cause higher hospitalizations. And in general, those individuals who are unvaccinated obviously have a higher likelihood of landing in the hospital. But the reason that line is curved and not straight is, we haven't done a deep dive to genetically analyze the virus that has caused every single person who's been hospitalized. We've analyzed many of them, but not all of them. And that's why I can't draw that line straight. Of the ones that we have sampled and genetically identified, we have seen variants among those.
Okay. And my other question is about the Gamma variant. Just in looking at the periodic report the CDC puts out about genetic mapping, it looks like there are some pockets of that. I guess it's hard to know maybe how thorough, but I don't know. How does that compare for you as a concern compared to the Delta variant?
The Gamma variant is not playing a large role in the generation of new cases in Maine. Indeed, in the latest round of sampling, the Gamma variant used to be called P1. We actually did not detect any in the batch of samples that we genetically analyzed. Does not mean it's not out there. It most definitely is, but it's not playing an outsized role in generating new cases. Right now, it's the Alpha variant that's probably generating the most new cases of the variants. I'm not talking about non-variants. I'll go back to that in a moment. But the one I'm concerned about, the one that I think is soon going to be playing an outsized role, is the Delta variant. Let me just amplify a piece that I mentioned, Charlie. Even though we're concerned about the variants, the good old garden variety virus is still causing a lot of cases as well. It's not as if that has been completely supplanted. But if the projections and models about the Delta variant are even within a half an order of magnitude of correct, the Delta variant has the possibility of supplanting others and becoming the predominant strain in much of the East Coast here in Maine as well. And that could happen as soon as one model suggests late July.
Okay, thank you, appreciate it.
Thanks, Charlie. And the last question for the afternoon goes to Patrick Whittle.
Thank you very much. Earlier today, I believe you said that there have been 4 documented cases of the Delta variant in the state of Maine. Is that right?
That's
And-
right, Patrick, but that is almost certainly an undercount.
Right. And could you remind us how long ago the first one was?
Oh, the first Delta, I'll go back and check. It was in April. I know, just looking at my data, I know it was in April, but I don't know exactly when in April we detected it first.
I see. Looking at some of the immunization data for the state, about 68% of the state that's age 20 and over has gotten their final dose of the vaccine. If that ends up being around where the state's total population plateaus, is that a sufficient number, or do we think we can and need to get it higher?
I'd like to be higher than that. It's a great number. It's a number, let's be clear, that other states would be envious of. And so in that respect, we're doing well. I don't want to be overly greedy, but hey, we're talking about keeping people safe in a pandemic. So I'm going to push and push and push. At 68, let's just call it 70%. That is not a terrible number. Obviously, that's in connection with the Biden administration's goal of 18 and over having 1 dose at 70%. But the reason I would like us to go higher is that it connects with the discussion today around the Delta variant. One of the things that determines what that level of immunity threshold is or should be is just how contagious the bug you're talking about is. The more contagious the bug is, the higher that threshold has to be. For measles, for example, you need to have about 95% vaccine coverage to really give widespread protection. The Delta variant is thought to be about 50% or so more contagious than the Alpha variant. And the Alpha variant was thought to be 50 or 60% more contagious than the garden variety variant, garden variety virus. So I think that 70% is good as a floor, but for me, it's not the ceiling.
Any thoughts as of now about what the ceiling might possibly be?
Too early to tell. We really need a better characterization of just how contagious things like the Delta variant are. But it wouldn't shock me if we landed at a place where the number that I'd like to see is in the order of 80%. That's in the ballpark we've been in previously. But that may be a number where we really zero in on as perhaps the new floor. But it's too early to tell, Patrick, really.
Got it. Thank you very much.
Yep. Thanks, Patrick. And thank you all for your questions this afternoon. I want to close with a couple of final notes, one of which Brian Sullivan has referenced. Next week, next Wednesday, will be the final scheduled COVID-19 briefing. That will coincide with the end of Maine's civil state of emergency. Now, to be sure, the end of the emergency does not mean that the pandemic has passed. Our COVID-19 work has and will continue. We're still going to be focused on investigating cases, working with healthcare providers, and getting folks vaccinated. But again, to coincide with the end of the civil state of emergency, next Wednesday will be the last regularly scheduled COVID-19 briefing. If there is news, if there's something important, if there's something that breaks, we won't hesitate to continue working with our colleagues at Maine Public to schedule another briefing. But as we bring these briefings toward a close, I'd like to take a minute today to thank a few folks who have been with us since day one. And the first group is someone who you see on the screen right next to me, and that's our group of interpreters. Josh and his counterpart, Dr. Thibodeau, have been with us since March or so of 2020. And so Josh, Dr. Thibodeau, if you happen to be tuning in, thank you so much for helping us translate and interpret our words so that people across the state of Maine can partake and understand where we are with respect to COVID. So thank you so much for your partnership. The other team I'd like to take a minute to thank is the entire group at Maine Public. They've worked with us since March of 2020 to bring these briefings to you to make sure that they were available and accessible for everyone in Maine. To the entire team at Maine Public, thank you so much. This is really, truly what a public radio and public media partnership is and should be about. So I offer you my thanks. And then finally, the last group that I'd like to thank is the entire team here at the Maine CDC. If I have been able to sit or stand and answer questions posed by all of my colleagues in the media for the past 15 months, it has been because of the work that the entire team at the Maine CDC has done. I have had the privilege and the honor of standing on their shoulders. And because of the work that they do and have done day in and day out, tirelessly, 24 hours a day, 7 days a week, since January of 2020, I've been able to convey that good work, keep the people of Maine informed, as well as to pull back the curtain and talk about, with passionate and loving terms, the field that I've chosen, which is public health. But I can't do that alone. I do that and I'm able to do that because of the work of every single person in this building and across the Maine CDC offices across the state. So I'd like to take a moment today to thank each and every one of them. If you happen to know somebody that works at the Maine CDC in any capacity, take a minute the next time you see them to thank them for the work they've done over the past year. Send them an email, send them a text. In my view, no one who works at the Maine CDC should ever have to have the hard work that they've put in go unrecognized. And this is my opportunity to do that. So on behalf of me, I'd like to take a thanks and offer my thanks to every single person at the entire agency. So with that, thanks to everyone for taking some time to join in today. Very much appreciate the good questions. We will convene next Wednesday for our final regularly scheduled COVID briefing. Until then, as always, please be kind and take care of one another. I'll look forward to chatting with everyone soon.